Time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributor Dr. Holly Phillips. First up, the CDC is investigating more than a dozen cases of the Zika virus that may have been spread through sex. Zika is suspected of causing severe birth defects. Here's John with more.
Angelica Yulchi, who asked not to be seen, and her husband Dustin were living in Brazil last summer when Dustin was diagnosed with Zika. Angelica was pregnant. Earlier this month, doctors told them to practice safe sex.
Since the doctor suggested us to use protection, we are going to use.
The advice either to abstain from sex or use latex condoms during sex is now being given by the CDC to all pregnant women whose male partners have been to Zika-affected countries. On February 2nd, the first known case of sexual transmission of Zika virus during the current outbreak was reported in Dallas. With this week's 14 suspected cases, the CDC is rethinking how the disease spreads. Jennifer McQuiston studies Zika at the CDC.
With these new suspected cases that we're investigating, we're really becoming more aware that sexual transmission may happen more often than we previously thought.
Zika has been linked to microcephaly in newborns, abnormally small heads, and developmental delays. The virus remains in the blood for an average of about 1 week, but can stay in semen for much longer, 62 days in one case. There's no evidence of sexual transmission from women to men.
John, if the CDC is reconsidering how this disease spreads, how concerned should we be?
There is a lot of anxiety, of course, whenever you don't have all the information, and it seems like every day there's new information here. One of the big things we're just learning is that Guillain-Barré syndrome, which is a form of paralysis, can be temporary, can be permanent, that can occur with infections. It seems to be increased 2 years ago in an outbreak in Polynesia, and it may be increased down in South America. The million-dollar question, of course, is what exactly is the relationship between Zika infection and this microcephaly? Is there some other thing that has to happen? We're seeing it in Brazil. It's not clear it's happening elsewhere. So maybe it's a 1-2 punch where you have to have something first, maybe dengue infection or some other factor, and then get the Zika. That's so important because, of course, I think people should expect it is almost certainly going to come to a mosquito in the United States, probably in the South first. People need to expect that, and we need to be prepared. What exactly are we going to do?
Yeah.
All right, next up, a new report finds mastectomy rates are on the rise in the U.S. The Department of Health and Human Services found mastectomies increased by 36% between 2005 and 2013, even though the rate of breast cancer stayed the same. So, Holly, what is causing this spike?
Right, Elaine, this was a very striking report. I think several things really contributed to this rise. Probably the most important has to do with awareness. For women who are at high risk of developing breast cancer in their lifetime, women are now aware that preventive mastectomy is an option. That's in part because, celebrities like Angelina Jolie and Rita Wilson have invited the public to come along with them on their journeys through that procedure. But there are other things that are at play. Reconstructive surgery is so much better than it used to be. Women used to be concerned that they would be disfigured after having a mastectomy, but now we know you can really achieve a beautiful aesthetic result. And then lastly, this may be the most important aspect, really comes down to screening. For women, we have genetic tests now and family history understanding where we can predict women might have an 80 or even 90% chance of developing breast cancer in their lifetime. For them, they can have multiple screening tests through the year. They might have an MRI, a mammogram, a couple of ultrasounds, and then end up having biopsies for false positives. That leaves them in this state of constant limbo, thinking, I have to wait for these results. What's going on? There are women who are saying, I want to be done with it all. I want to lower my risk as much as possible and take out the breast tissue.
So, John, should we say this is a good thing, this increase then?
Well, it's a good thing if women have more peace of mind, as Holly was saying, and a good cosmetic result is a good thing. It is more expensive, more complicated. But I was talking to Dr. Freya Schnabel, who's the head of breast surgery for NYU Langone Medical Center, and she was pointing out you have to be careful here in terms of thinking, is there a survival benefit? That's not as clear, and especially for women who have had, say, an early breast cancer in one breast. Doing a bilateral mastectomy, it's not clear that that has a survival benefit over just doing a lumpectomy and radiation. So overall, what's so important is that it's a very nuanced subject, and women have to talk about all the pros, all the cons with their doctor and really go over what is their risk profile. And what did they want to do specifically?
All right, a cup of coffee is a must for many people the morning after a long night out on the town, but a new report finds coffee may do more than just help ease the effects of a hangover. Holly, what did this report find?
This is interesting. The report really found that drinking coffee may help to decrease the risk of developing a type of liver damage called cirrhosis, which is caused usually by heavy alcohol intake or other things like illnesses like hepatitis and autoimmune disease. So specifically, researchers looked at 9 studies that had already been published involving more than 400,000 patients, and they found that people who drank an extra 2 cups of coffee a day had a 44% decreased risk of developing cirrhosis. Now, we do have to point out the caveat: this wasn't a clear cause and effect study. They couldn't show that coffee directly lowered the risk or if it was just an association or a link. Still, cirrhosis kills 1 million people a year. There is no cure per se, so whatever we can do to decrease the risk really matters.